Way.
Okay. Hello, everyone, and welcome to Responding to the Needs of Family, a practitioner's perspective amid COVID-19. I'm Kathleen Gimma, Senior Director of Content and Brand Management at A Second Chance Incorporated. On behalf of our President and CEO, Dr. Sharon McDaniel, our COO, Brace Lowe, and the entire team at ASCI, thank you so much for taking time out of the day to join us for this conversation, which we hope will be informative, engaging, and inspiring. Our moderator for today's webinar is Jay Kadash, ASCI's EVP for Communications, Content, and Systems Engagement, which is the national engagement arm at ASCI. Jay has a master's in both communications/public relations and education, all within the context of the nonprofit sector. He also holds a certificate in graphic design from Moore College of Art and Design, and his experiences widely range across education, child development, marketing, grant writing, and graphic design. So Jay, take it away.
Thank you, Kathleen. Good afternoon, everyone, or good morning for those of us who are joining us from a different time zone. Before we jump into the session, we just wanted to go over a few of the housekeeping things. You should see a screen, and we do have everybody automatically muted, so you don't have to worry about that. The only thing we ask, if you are listening by telephone instead of the audio option, sometimes there is interference. So if you can place your phone on mute, that would also help us a lot. So with that, I want to begin. So right now, we're kind of right in the middle of going through this COVID-19. And the one thing we've been looking at in particular is tactical strategies. What actually are people doing on our day-to-day basis? If you were on the webinar yesterday, we had a really good conversation with Dr. Walter Smith, and he spoke a lot about control and the feeling of the loss of control and how that control really adds to our stress and trauma in the moment. So right now we're looking about how are people in human services, how are people in child welfare, people working with homeless, how are they keeping things in control in their personal lives, in their professional lives, so they can serve the needs of the families and the people they're helping and healing every day. So we did have two purposes for our webinar today. The first one was to really look at tactical strategies. What are we actually doing? What communications are we putting in mode? What staff changes have we made? And how are we making things so that we maintain the safety and well-being and the permanency of children for our families and our staff? And the other thing we want to look at is what are the actual plans and strategies needed to address this, specifically from the lens of human services, which is much different than other first responders. So today, I'm really pleased to say that we have some really great speakers lined up for you. We have people from national leaders in child welfare, both public and private. We have people that are data experts from education. We have community leadership, and we have somebody to really speak on diversity, equity, and inclusion and how that looks at this time. So our first speakers are my colleagues from ASCI, Caitlin Price and Tara Skibble. Caitlin is the EVP of Children and Family Services in Philadelphia. She is a licensed social worker as well. She earned her master's in social work from Marywood University, and she has over 10 years experience in New York and Pennsylvania. Tara is the EVP of Child and Family Services in Pittsburgh. Tara actually began her career at ASCI in 2016. She was a director, she was a vice president, and now she's an EVP, so she has a lot of experience looking at a lot of different lenses. She has more than 14 years of experience. She has a master from my alma mater in social work, University of Pittsburgh, and in 2013, she completed the requirements to be a licensed clinical social worker. So we're happy to have Tara with us. So Caitlin, Tara, from what seems like this never-ending cycle, each day you're going to have to transform what the typical workspace would look like during this response. Can you speak to the specific administration strategies you have put in place and continue to evaluate to ensure the safety and well-being of children, your staff, and even yourself? So with that, I'll let you guys take it off.
Thank you so much, Jay. So this is Caitlin, as Jay said. I work in our Philadelphia office for A Second Chance. And so we wanted to start first off by talking about the need for high-level communication. So particularly during this time that we are virtual, and that there is a need for social distancing. There is this high level need for communication and for a sense of urgency around our communication with not only with our staff, but also with our caregivers and families. And so first what we did was we really wanted to communicate regarding changes, updates, anything that was going on in real time to our caregivers and to our staff. And so whether that was via email, via text, our wonderful communications department updating our website, our calling our caregivers, having virtual visits. So whatever way and multiple ways that we were communicating regarding any changes and updates, whether it was things that we were doing differently as an agency or changes in our region that we were hearing as far as it relates to schools being closed or changes into how we do business, so that we can make sure that however we need to get out there, that our staff and our caregivers remain consistently informed. And also as part of that high level communication, we also want to make sure we were consistent with our community partners. So that's things like CYF and our community umbrella agencies. So whether that's a phone call or email, updating them as consistently as we can, a weekly phone call with all other providers so we can stay on the same page. These are all very important to make sure that we really understand what it is that we're doing and that we're sharing resources, we're sharing ideas, we're sharing this understanding of what is going on within our community. And lastly, another thing that we did is that we immediately launched what we called our COVID crisis line for engagement of the triad. And so while certainly our families could reach out to their assigned caseworkers, we know that there's a lot of people on the phones and sometimes they can't maybe immediately get through and they wanted maybe just some information or just to talk to someone. And so we launched the COVID crisis line that we could check consistently to see, what the needs were of the families, what things had changed, where they could get information that would be important to them. And so we thought that this was another way, another area where families could get in touch with us and we can stay in that high level of communication based on the needs of the family and or our staff. So Jay, you can go to the next slide.
Hey, Caitlin, before I go on, could you just tell people what the triad is in case they're not familiar with that term?
Absolutely. And so when we speak of the triad, we are talking about the caregiver, the birth family, and as well as the child. So we're making sure that we're reaching all three levels and that there's consistent engagement. We're making sure that there is communication between the children and their birth parents because that's essential during this time. So while they might not be able to have the physical presence and physical relationship, we're making sure that they are still in contact and speaking with each other. So when we talk about that, we really want to include all levels and not just our caregivers. So
Thank you, Caitlin.
Absolutely. And so one of our biggest things that we have to take in consideration during this time is obviously the high level of safety and well-being for our caregivers. So at any point in time, that is our number one goal, of keeping our caregivers and our kids safe. And so in order to do that, we really instituted some high-level data tracking. So again, we could be in the know and we could better assist our families. So one of the first things that we did was we put our homes in a triage into what we called high, medium, and low risk categories so that we could really assess what needed to be done with each family and what the needs were so we could prioritize the work. Because as we know, each family is going to have different needs and we're also going to have different levels of availability. And so we wanted to make sure that we really understood who needed what during what time so that we could reach out to them more frequently or get supplies out to them or potentially do in-person visits if that is required during that point in time. And this was all tracked on a singular report for both offices that we could access, so that Tara and I had access to all the families down to the caseworker who had access to the families, so that anytime any of us could get involved and better help to assist the families and help our staff to better prioritize the work during this time, as not only are the families shifting, but our work is shifting as well. Then the second thing we did was we instituted a daily report. So this is so that we're speaking with our direct teams daily, and we can ascertain any challenges, whether it be maybe they had some challenges with their computer or getting in touch with a caregiver, and that we're verifying the work being completed. As we're shifting to this new way of working and their children are being home, we still wanted to make sure that they have the ability and accessibility to be able to reach our families the way we need to, so that they're seeing everyone, that they're assessing the needs, they're assessing for safety, and that we can verify that this work is being done, because that's still important to us. And then lastly, tracking tools were developed to be able to have full accessibility to information in order to make best point in time decisions. So we could pull up automatically when the last home visit was, what kind of home visit it was. We could pull up the needs of that particular family and where they address. Again, we put them in triage so we could address those high level staff and making sure that those those children were addressed in a certain way versus our low risk. And so these tracking tools really helped us to make sure that we understand kind of what's happening on a day-to-day basis, and that we can make sure that we're really ensuring the safety and well-being of our children in care, and that nothing is missed, because we know that there's just this high sense right now, and people are scared, and so we just really want to make sure that we are there for our caregivers, but that we're also there for our staff. And so being able administratively to find that balance, this data tracking really helped us to make sure that we're staying on track during this time and providing all needs. You can go to the next slide, and I'll pass it over to my colleague, Tara.
Thank you, Caitlin. This is Tara, and I'm going to kind of talk for the team right now about how we've used technology for engagement. And I think the one thing that Caitlin and I really wanted to emphasize is we've really spent a lot of time working within our teams on how do we make sure that that engagement is still genuine engagement, high level of engagement. We know right now this is a transition for our families and our staff regarding a lot of virtual. So wanting to make sure that we can still keep that personal experience in each of those interactions has really been something core for us. So one area that we first started with when looking at our triaging that Caitlin mentioned was really to assess what our families needed relative to technology and even our workers. So really looking to assess if they needed specific equipment. So did we need to go out and deliver additional smartphones so that we could do virtual and video visits? Or did they need maybe some training and some skills to help be able to utilize maybe apps that they already have on their phones? So that was really our first area of focus, is really that assessment, and then to help provide that support. So looking at on an individual basis, an individual family, client, birth parent, staff basis, how we can help provide training, support, hands-on coaching so that we can help them become more comfortable in this space, because we know that as working remotely and trying to do increased virtual visits, that it is something that can be changed and can be additional stress. And our goal was really, how do we help reduce that stress when we know that we're already living in some uncertain times that are causing stress for us? One area that we really worked to enhance was looking at how we can help explain to our families what is occurring relative to virtual visitation. So those families that we triaged that we were going to be able to assist with some virtual visitation is really, how do we explain that? And to do that, we actually created a live video that helped in advance so they would know, what does that look like? What are my caseworkers going to be asking? How can we do a virtual walkthrough of the home together so that we can see things? And then how can we engage our children and youth during those visits and still have that one-on-one time? Because we really value, when we're working with our triad, making sure that we're giving everybody an opportunity and a voice and a space to talk about what their needs are and how they're feeling. So we took that and created videos and trainings for our families to do, but also for our staff. And looking at from a staff perspective, how do we go from being able to be on the floor and playing games with our kids or playing a video games while you're kind of talking to them about what's going on, relative to now we're doing something more virtual. So we help to create and pull together lists of activities and things that we can do virtually based on age range and based on developmental and based on interest. So we talked about, how do we play a game together virtually? How do we potentially kind of go on a walk together virtually? How do we, draw a picture together based on a child's age? So really try to give our staff and our families ideas so we can really make sure that that's some quality engagement for us. Another area that we looked at is really looking at all of the services that we currently provided at a second chance and looking at how can we still make those high quality services in this time. So we really looked at our youth engagement services. So currently those services would have been groups or one-on-ones, but how do we move that? And we moved it to virtual groups. We also looked at hearing from our youth voices, what else did they need? So we did some phone assessments and feedback from them to understand what did they need during this time. So some of those ideas came out is that, you know, there was a high wanting to have a YouTube channel. So right now that's something we're working on, is launching a group YouTube channel so that we can help share videos and clips that are appropriate during this time as we're processing together. We even look at for our family group decision making. So how can we still have a high engaged conversation and meeting, but do it virtually? So we've been able to host some virtual ones where we potentially had food delivered in advance to each participant so that they were all still able to have that meal together, but we did a virtual meal. So trying to really take every activity that we're doing and help get the feedback of the triad and how we can really help to make it a different experience right now, but still a positive experience. Another area that we saw is, of course, as this has been continuing for us, that there's been, you know, continuing stress and concern about the isolation. So potentially our kids feeling isolated, our birth parents, members of the additional triad, our caregivers. So we were able to kind of launch what is a family wellness warm line throughout both offices. And this is a line that's being manned by some of our clinical experts who are able to really be a voice and just allow someone to call in. You might not have a tangible need, but you might just need someone to talk to. You might be feeling lonely that day. You might be potentially, you know, feeling the additional stress that's going on based on financial burden. So the warm line is allowing us in that capacity to provide another space where you can feel kind of that unjudged perspective, and we're just here to listen and provide some reframing, some additional coping, and some additional strategies. So those are kind of some overview of the high level of some of the engagement techniques we've been really focusing on at a second chance, and are continuing to evolve, as Caitlin mentioned, every day to figure out how do we help meet that need of our families, those tangible needs, and as this is going on. So that's all I have, Jay, so I'll turn it right back over to you.
Thank you, Caitlin. Thank you, Tara. I always take notes when I'm listening to speakers, and I loved how you really talked about we have to heighten our senses. You know, at Second Chance, we've always had staff wellness, but what does staff wellness look like now in COVID-19? So we had to heighten that awareness. You know, Tara talked about, we've always been engaged with our youth, but how do we heighten that engagement with youth? And we're looking at that YouTube channel. So I think, you know, it's really great that you talked about that heightening sense. Some of the things that Tara and Caitlin did talk about, if you go to the A Second Chance website, you will see information about the family warm line and some of the interactions that we're having with our families if you want a little bit more information. So now it's our next pleasure to introduce Heidi Hochstetler. Hope I said that right. I've been practicing Heidi all day. Heidi is an MSW, and she is the KUA 10 director at Turning Points for Children, which she's going to explain to you what that is. Heidi's originally from rural Ohio, but has been working in child welfare and in Philadelphia for more than 16 years. She has an MSW from Temple University. And she's been working for nonprofits for a long time, Turning Points for Children for the last 10 years. So with that, I'm going to set it up for Heidi. Heidi, from where you sit, you know more than ever that we have to have this critical importance between the public and private partnership, especially during this pandemic more than ever. Can you speak as to why this coordination is really important at this time?
Right. Thank you, Jay. So I'm Heidi. Thanks for having me. I'm going to be talking about child welfare case management services on sort of a broad level, but also want to sort of walk you through my perspective and my lens that I'm speaking from Philadelphia County. So some of you on the call may be familiar, some not. In Philadelphia County, the Department of Human Services, or DHS, does the investigations of the reports that come in for child abuse or neglect. And then when an investigation determines that services are needed, whatever level of service that is an ongoing service in child welfare, those referrals are given to the community umbrella agencies, which Caitlin referenced earlier in her presentation, or the KUAs. So Philadelphia County is divided into 10 regions for the KUAs who provide that continuum of service. That includes the in-home services, placement at all levels, to permanency, to adoption, finalization if they are being adopted. And then of course we provide aftercare services as well after cases have safely closed. So there are 10 regions. Turning Points for Children, the agency that I work for, is responsible for 4 of those 10 regions, and I manage region number 10, which is sort of the orange triangle to the left of your screen in West Philadelphia. So of course, in operating the ongoing child welfare services, we're accountable to a lot of different stakeholders and system partners. That includes DHS, it includes the families that we serve, it includes local and community stakeholders, and system partners include everyone that touches these families and children. And so the schools, the medical providers, behavioral health providers, the court systems, foster and resource parents, and other social service agencies and community resources. So it's really important for all of us to stay connected during this time of COVID-19. I'm going to be speaking specifically in sort of 3 parts about what are some tangible ways of virtually and physically supporting the different levels of service delivery and child welfare through COVID-19, focusing on how we continue ensuring the safety and well-being of the children, youth, and families that we serve, how we're supporting the professionals who are delivering the service, and then why and how we're staying connected as system partners through COVID-19. So you can go to the next slide, Jay. So to start out with the safety and well-being of children, youth, and families, with the virtual connections, of course, some of them were already referenced to. I'm sure a lot of you on this call are doing a lot of similar things. In general, it's making sure that we're staying connected to our families by virtual means, text messages, phone calls, a lot of video calls on different platforms that people are using to do these video calls, but really just making sure that the families are feeling connected to us and have us to go to for questions and concerns and resources that they need. With the video conferencing, of course, we are using the video calls for a lot of what we previously did face-to-face. So that includes the home walkthroughs and visits, the assessments that we're doing, so safety assessments in the home, and developmental questionnaires that we're doing with the younger children, life skills assessments that we're doing with the older youth, and then also doing the video calls for supervised visits. So when we previously were doing the supervised visits with the parents and children in our offices, with staff supervising, all of those court-ordered supervised visits have now moved into video conferencing. So it's sort of a 3-way video call with the parents and their children and our staff to supervise those interactions and visits in the same way we did previously, but virtually. Resource sharing is a huge part of how we are supporting our families and children right now. So resource sharing involves a lot of different types of resources. So information on access to food, information on jobs that have become available for those that have lost their employment and their source of income, virtual mental health and behavioral health services, information on what to do if someone in their home is feeling sick and exhibiting symptoms, what the recommendations are from the CDC and where to find that, making sure that families know how to utilize these virtual services. So we've done a lot of walking through and coaching of how to do video calls and utilize these methods that families weren't using before and are having trouble sort of navigating on their own. And then of course there are lots of in-home activities that are happening and being shared. So including virtual museum tours and zoo visits, exercises, educational activities. There's virtual open mic nights and trivia and games. So there's a lot of really fun things to be shared with our families, to be doing in the homes with the children. And of course, one of the main methods of getting that information to them quickly and consistently is through social media platforms. So in our agency specifically, in my program, KUA10, making sure that our Instagram is updated with what those resources are in the community, what these ideas for activities are that we come across, and having it be a quick reference place for families to go to, asking them to follow us on Instagram so that they can stay informed of what's going on and what they should be taking advantage of. And then of course, hosting some of virtual platforms, which were spoken about in the earlier presentation. So having opportunities for parents and caregivers to come to these virtual platforms to support one another for parenting support, parenting classes, and for financial planning and budgeting workshops. We've been doing some of those as well. So there are a lot of creative things that we can be doing. And of course, there can still be incentive for being a part of these virtual platforms for families. So virtual giveaways, virtual gift cards, and deliveries to their homes of things that they might need. as virtual incentive for being a part of these platforms. And the next slide is going into those physical supports that we can still be doing for the families. So we're doing a lot of deliveries of groceries. Food is really the biggest need of families right now, but there are other things as well. So for example, some of the older female youth for feminine care products to be brought to their homes. For the babies, the diapers, wipes, and formula are always needed. Really talking to families to see what it is that they're needing in their household. So we actually have had some tables and chairs delivered to homes recently because schooling in the home was not something that families were doing before, and they didn't really have means to do that was effective within their household. And so talking to the families to see what it is that they really need to make their life a little less stressful in their homes day to day as they're now educating their children in a way that they weren't doing before. Of course, we are still doing face-to-face visits as needed. So if it's emergencies or there's a placement disruption or move that needs to happen, then we are still going out to do that face-to-face physical connection with the families. And if there are families that don't have a means of doing the virtual visits with us, making sure that we're going out to see them, and of course then seeing if we have the ability to get them those devices if they need them. And the next slide goes into how we're supporting the professionals who are providing the services. So a lot of virtual contacts similar to with our families, but really making sure that we are staying connected as a team. Having that consistent communication from their direct supervisor, continuing to have our weekly supervisions by video so we can see one another and really talk to each other about what is going on, having our team meetings together on video calls. Within my team, they've actually asked for more video calls to check in with each other. So knowing that it's really impactful to them and important for them to see one another and stay connected within their team. And then with the resources that we're sharing with our families, these are resources that we are also using in our own homes, because of course, it's sort of a parallel process, as one of the presenters called it yesterday in their presentation, that we're helping our families go through something that we are going through at the same time. So all of these activities and things that we are identifying as resources to share with our families, to use them in our own households as well and share them with our professional colleagues in supporting each other with idea sharing and support. It's also important to continue trying to have fun with one another. So, making sure that we are giving kudos and shout outs for work well done by staff, virtual acknowledgement of one another, and activities that are also happening within my program, specifically, just as an example, we have what's called Workout Wednesday, where there's a virtual call-in to do an exercise together in the middle of the day on a Wednesday, just for fun, sort of to regroup, stay connected and energized with one another. We're also doing a TikTok challenge within my program. So just fun things to do together as a team to stay connected virtually through COVID-19. And then, of course, to think about virtual supports that we can identify during this time for our future service delivery and child welfare, what that might look like, what may be helpful to us in the field of child welfare, things like tablets for electronic signature of documents, just as an example. So to really be thinking about how we can move this to the next level in the future. And then the next slide is the physical supports for our professionals. So of course, the most important thing that they need right now to make sure that they can do their work effectively is devices that are working. So they need to have laptops, smartphones, Wi-Fi access, and they need an IT help desk to support them at times where they need troubleshooting with those things. Of course, we're minimizing staff presence at the office and minimizing face-to-face contact as much as possible. So having a structure in place for when that is needed to happen. And of course, when visits do need to happen for those safety concerns with families, that we're equipping our team for when they go out, that they're asking questions before they go to the home, asking about whether someone in the home is feeling ill, if they're exhibiting symptoms. And then when they go to the home, making sure that they have the protective gear that they need as much as possible. I know it's hard to find some of these things right now, but sanitary gloves and sanitizer and face masks for when they're doing these in-person visits. It's really important to support them. And thinking about their own self-care plan. So asking our staff what they do to take care of themselves through COVID-19. journaling, exercising, music, whatever that plan is, but really checking in with staff on how they're caring for themselves through the physical distancing, but keeping that social connection. And then the next slide moves us into staying connected with our system partners. So obviously this is important because we are working with mutual client families, and if we are not on the same page, it causes confusion to the families. So making sure that we as a system are really alleviating some of that stress for families by staying connected to one another. So having virtual conferences with one another in the homes with families to minimize those number of visits that they're having. And ensuring that our families know about resources that other service providers are offering, and being the liaison with that service provider if the family has not gotten it or has not been in contact with them to get it. So as a system, it's really maintaining that communication with one another, because together we're so much stronger in advocating for what we need as a system and what our families are needing as a system. And the last slide, just to close us out on this part of the presentation, is methods of staying connected, which, having consistent virtual platform opportunities like this one, thank you, A Second Chance, and utilizing those platforms. So being a part of them as they become available. If you see a need for one, creating one. We need to be providing updates to one another, asking questions of one another to continue driving how we innovate during this time to improve our system and continue it moving forward. Keeping our social media platforms updated so that we're aware of one another's resources, one another's virtual events, getting involved in them for our families and ourselves. One of the things that we do in COVID-19 as far as staying connected is a weekly virtual case review of all of the system partners involved in our cases, where it's video calling to go through the new referrals that we've received with community behavioral health partners, the nurses, domestic violence supports, parenting programming. It's really the team at the table in a virtual way to stay connected on our cases every week. So that's really my presentation. I just want to end by saying that it's a time for us to take advantage of hearing ideas from one another and thinking about ways that we can evolve and enhance our service delivery system in the future post-COVID-19. Thank you so much.
Thank you, Heidi. Really appreciate that. I think it's important what Heidi said of maintaining partnerships. And when we were in the planning stages of this webinar with Dr. McDaniel and with Brace Lowe, it really was critical that they wanted to hear the voice of our partners together with us, so that it's a partnership voice. And I think that's coming through in the webinar. So Heidi, thank you so much for that. We're going to move on to the focus on education, which is pretty apropos right now, because today, as you may not know, or may do know, that the governor of Pennsylvania did close all the schools for the rest of the year. And when we think of that, it's dramatic to close the school for one day, for a snow day, because of the effects that it has on families. We don't know what's going to happen now, but you're closing down the school for the entire school year. So I'm proud to introduce you to Dr. Christine White-Taylor. She is the educational liaison at A Second Chance. She has an extensive career as an education administrator and providing counseling services in education. She is the agency's liaison, which means she works to advocate for students, their families, and their caregivers. This is a very important position for A Second Chance, because it really shows how child welfare and education are really together. She's also proudly a two-time graduate of Duquesne University. So Dr. Taylor, it's not surprising that we're already seeing an educational divide in the education for children based on zip code. I think now at the closing of all schools for the rest of the year, we might even see it more. So can you speak to some strategies we're putting in place that address the immediacy of what's going on with education, but also then what are the long-term ramifications of what's going to happen with our students and COVID-19?
Thank you, Jay, for that great introduction. I really appreciate it at this very, very difficult and challenging time for those of us that are in education. And we found some very interesting things out about ourselves, as you do when there are times of challenges and trouble. We seriously, in the world of education, and those that work with us, we must check our preparedness. In a lot of areas, school districts and schools across the country have, in a way, been caught with their pants down. They weren't prepared for what COVID-19 has brought to us. It froze us. We're accepting directions that are dictated to us. National and state governments are televising directives that mandate our lives in this time of physical distancing. That's a new term. We're looking at increased levels of responsibility in areas we wouldn't have never thought of, and education is one of those areas. As it was mentioned yesterday during the webinar, and I'll echo it today, right now we have more risk for children. They're inside, and controls are vastly different than they would be if they were off during the day at school or with other caretakers. This unexpected virus changes, it's going to have to change our role, our life role, and it will put us as a society in not only in the unexpected positions as we are right now, but also uncomfortable ones. We must take a different approach right now when we look at education. The first slide, as it says, education is, and really today, is a child welfare issue. The child welfare system and its entities, the agencies, we must assist in the change in priorities that of shelter, food, clothing, education, training, and preparation for independent living and post-secondary life is also a priority. Regulations, legislation, public protocol has to change to include the responsibility of involving family in homebound instruction. We're seeing it now. We have parents that are reaching out to us, and probably across the country, as school districts take the distant and virtual instruction, that we need computers, we need iPads. No longer can you expect face-to-face instruction or training to be a guarantee in our future. Families have moved away from instruction and training as a priority. Training and instruction can no longer be approached as something that occurs out and away from where children live and sleep. And as we just talked and heard about how we engage families and our partners, education is going to have to be a part of that dialogue. Family units are now again going to become at-home teachers. Distance learning and virtual learning and instruction, as well as our television stations and training, they're going to have to take place in homes. Next slide, Jay, please. According to 2010 census data, stated in a 2019 Associated Press report, 3 million students in the United States do not have internet in their home. 18% do not have home access to broadband internet. What does that mean for our students that now have to participate in learning outside of the school building? More responsibility for child welfare. Child welfare entities and systems are going to have to include in the well-being and safety priority that what is needed to educate children, that has to be included. The virus pandemic has made us acutely aware of how life is when everyone is in the home. Instruction delivery and training ability must be a required presence. Got to look at televised or internet education and how it will have to occur in the home and how it will be guaranteed that it is taking place. No more face-to-face instruction, that's now a luxury. The position must be one that drives a very strong message that well-being and safety includes what it takes to conduct instruction and learning while in the home. Yesterday, we heard in the webinar from Dr. Cheryl Hall Russell. She talked specifically about a shift in the nonprofit world. We must now conduct a shift in the world of education and become politically involved and become the voice, the drumbeat leader, the advocate for education. Things will be vastly different from today on as we look at students that will not participate in an in-person graduation. these are life-changing events that we look back and have memories about. How will we talk about the prom now? Or how will we talk about things that are celebratory for our students that are moving on to a post-secondary plan in their lives? Next slide, Jay, please. As we look deeper into what physical distancing means, changing the current and perhaps the future, physical distancing has suddenly included the responsibility of education, training, and instructional delivery in the hands of caregivers. Now, more than ever before, education is at the top of the heap. Everyone is looking to what happens during the day for students that are in school or participating in training programs. The new normal for family style living is going to have to include the inclusion of home instructional delivery and distance learning via internet access. Adequate homes require the ability to manage and deliver educational instruction in concert with school districts. New policies, and these are policies that we must be in advocacy of. We have to make sure training within the home for school-age children has to be in place. Public policymakers must assist in providing affordable internet service. Again, looking at policy, we as a country have a lot to learn about how we live during this time of this pandemic crisis. There has to be a focus, a continued demand for our leaders to rank education as a high priority. Schools can assist in broader public health programming. We're going to really see just exactly what the needs are and what the clamor will be about in the aftermath of COVID-19. This is definitely going to command all of our attention. The attention must include a greater investment in education. Education touches the future. Doctors, lawyers, teachers, researchers, social and caseworkers are in the making. As things improve and eventually we send students back to a safe school environment, we have to let our leaders in government hear our voices and convince them not to forget about the impact on education delivery to children and families during this crisis. I can't say enough that a focus on education right now, this is the time to actually adjust and come into the 21st century. That is something that we have to influence, require, and model. Thank you, Jay.
Oh, thank you, Dr. Taylor. A lot of this hits home because it's so recent in the news. And I know when I'm talking to Tara and Caitlin, our caseworkers now, are getting tons of questions about education and schooling in the home. So there is this connection that education and child welfare are going to have to get way better connected than they currently are. And the other thing that really stood out when you said the increased level of responsibility that is now on caregivers and parents. If you think about your own, when you were a kid, your parents' responsibility was helping you through education, with homework, with reading. The responsibility was not, being your teacher for 7 hours during the day and when everybody's in the house, as Dr. Taylor said. So lots to think about, Dr. Taylor. Thank you so much. I want to move on to our next speaker, who is Jackie Hoover. Jackie Hoover is an LSW, and she has over 25 years of experience in child welfare. She is currently the Deputy Director for Allegheny County Children, Youth, and Families. In addition to that, she has a pretty extensive work with lots of family engagement strategies, targeting system integration. She actually founded and managed the Teaming Institute for Allegheny County's Department of Human Services. She has her master's in social work, once again from my alma mater, University of Pittsburgh, so that's great. Jackie, I know you really are working tirelessly. You're working all day long, each day, every day, till late in the night. And as we go further into this pandemic, we're more aware of all these critical, important issues between public and private partnerships, some of which Heidi talked about. So with your expertise and from where you sit, we're looking forward to your perspective today. So take it away, Jackie.
Great, Jay. Thank you so much. So that's actually a great lead in. I've been listening to everybody and, really valuing all the points that folks are making around how the need needs to shift. And, what I'd like to focus on now is how we shift together. And, when this started almost 4 weeks ago, which now seems like a decade, initially what we heard was uncharted water, unprecedented territory, these really sort of scary words. And I started thinking about what that meant to us. And, I heard from Dr. Walter Smith yesterday really talking about the control, and maybe this resonated with me since Dr. Smith was one of my mentors. I felt the need to do that right away. Just, one, to, decrease my own anxiety, but also to be able to lead not only a child welfare staff that is immensely large, but also, a huge provider. As we are a Department of Human Services, much like Philadelphia, our providers span is very great, and now is the time more than ever that it's super critical for all of us to work together. So starting at ground zero, we took the temperature as what is our focus, and really going back to the mission. How do we continue to move forward, talking together that we are aligned with our mission? And we started by going and making sure everybody knew what our defined mission was. And for me, it's primarily child welfare. However, we did shift, since we are a Department of Human Services, is what does that service delivery and information sharing look like across the whole department, and who does it affect, and how can we keep everybody on board, and truly, understanding what's essential right now. Many of you listening in have been planning really fabulous prevention and EBPs with Families First legislation. However, now what's really essential? How do we decide what's critical today, and then also plan for tomorrow? And, also, as Caitlin and Heidi, reiterated to, looking at people's needs. And I know Tara talked about this with a second chance as well. And we started that first week with really talking about the 3 M's. And by that, I mean mindfulness, meaningful connections, and movement. And, really focusing on the meaningful connections about when we check in with our youth, our families, our staff, and providers. And that's sort of been our montage moving forward. How do we have meaningful connections across a public and private partnership? So you can flip to the next slide. So really, where we started was informing our child welfare staff that, you really are stewards of the county, and really empowering people that, we're going to give you the facts that we know based on information that's coming from, individuals higher up in the county, from our partners at the Department of Health, and that you will be knowing information that's factual, and sooner than you would hear through the media. And we want you to go out, and we want you to share this information. And we did the same thing with our providers and our stakeholders, and the same with our children and our families. We often, like a second chance, refer to this triad, and we found this triad as critical to sort of taking control of what we can, and how do we decrease people's anxiety around what is real, and decrease perceptions around hysterics. So we were really checking in at every level. We would check in with staff daily at multiple levels of management, much like you heard from Caitlin and Heidi, as well as Tara, but also doing that with providers and with children and families. So while we were still in our homes and visiting, conducting investigations, what does the other meaningful connections look like? During virtual visits, what are we asking? Who are we connecting with? And also making sure that we're asking daily about the resources. Much of what we found was changing every day. And how do we monitor that daily input and output? And like Dr. Taylor has said, how do we shift? And whose job is it? And, in my job, it's much like, how are our children doing? Where are they? who's singing them, and how can we plan with everybody who is connected to them to be able to give factual information around where they can get resources, to get information from them about what their critical need is, and then to share and advocate for them, and really using these levels to plan and prioritize what's essential. So, we did exactly like others have done, really talking about how you triage, like Caitlin had discussed earlier, who is at the highest need to get what. And so that way we did that early on so that it felt more in control for our staff, that we were able to say to them, these are folks in critical need. We're going to prioritize most critical, and then we'll keep moving. Every day we go through the list, and because people might not have a critical need today doesn't mean they're not going to be at the top of the list tomorrow. So go ahead, Jay. So this is how we started communicating. As you can see, we have a daily provider call, and this is across all of our DHS providers. We started sending it out just little by little, and it has grown. So we created a web page for it. We record every phone call. We have a chat that's going throughout the debrief. So we answer questions in groups of hundreds. So that way, if one person's asking a question, it's not, taking a terrible game of telephone, communicating it. People are hearing it at one time. Maybe they hadn't thought of that. It's just a way to clearly communicate, one, not only our current message, but also to hear from them, what are the questions that they have? What is it that their people that they are serving? What are their needs? And it really is basic teaming at its best. And what we do is every day we provide an essential service snapshot. So you can see from food for seniors, aging services, childcare for our employees and other essential staff and first responders, early intervention, child welfare, intellectual disabilities. We all give an update as to where our service delivery is at. So that way it's also, again, making sure that we're in control of the message and what people are hearing, and that it's really fact finding. These are, the facts, and it's given by me every day around where child welfare is around service delivery, our supplies, just, what we look at. So that way it really sort of dispels the rumors. And what we also do is we give, health updates. It's a place to have where you can see how many folks have tested positive, all the information from the health department. We really talk about legislative updates, where we're at and asking for some of those and information we're getting back. And then what we have found is it's a great place to share resources. We have guest speakers from what we hear from people, whether it be the courts, individuals around intimate partner violence. Yesterday, we really focused on employment and training because, again, we're using our information to sort of shift as to what is the next point of need, if you will. So go ahead, Jay. And, this is, again, what folks have talked about throughout the course of this call, but you really have to go back to data-driving decisions. And so you can see this is the data that shows, I'll start at the top where you can see that the child welfare referrals, and that we've had a 52% decrease in our calls that are coming in. So not only do we have to define those at most risk. When we first started working, we did that of those who are in our system. Now we need to, as Dr. Taylor has said, shift and pivot. So, where are those other children at, and what can we do that isn't necessarily has always been in my scope? Maybe others that have focused on prevention. How do we work together to determine who is at most risk? Let's look at the pain points, and then let's talk about those with our staff and providers in planning. And we need to prioritize what is critical. So initially we started with conversations around, this is what we know, and I'll just speak from my child welfare lens right now. In child welfare, I know that children under 3 are the most critical, and that our previous data has showed us around our near fatalities and fatal incidents is that they've all had to do with intimate partner violence, abusive head trauma, unsafe sleep, or ingestions. So that we started focusing on how do we partner with our IPV specialists in getting people the resources that they need if they don't have phones, if they don't have the technology, and then how do we increase our visits on them? How do we provide lock boxes across the county for people to put, as we saw an increase in people hoarding over-the-counter medications? How do we educate caretakers around the need to store that safely? How do we engage staff and providers and people who are seeing these children and families? Because as you can see, with a 52% decrease, we're not seeing them. So we've understood that we had to be fluid and flexible, and then we have to analyze and implement. So what's next as it comes, towards our whole system? And, I think it's also very similar. It's no different than the medical models that they're using, around to flatten the curve. How do you measure what's happening and then predict? I think that, most of us are really keen in doing that. It's just now we're sort of running an ultra marathon. Many of us have been used to running sprints and then a marathon, and this is really an ultra marathon and having to look at the past, the current, and the future. And it's really, I understand the struggle, to be in a day-to-day crisis, because that's really where I'm living right now, but also thinking about what is the future. So our future needs will be very much like Dr. Taylor says, where does child welfare and education meet? And that's, it's not just a default to child welfare. If we're really talking about community building and community partnering, where is the partnerships across stakeholders, across foundations, providers, community members? Where do we find the point to meet together to look at the need from education? It will be employment, it will be housing. How do we start thinking about those things even in the midst of crisis? Go ahead, Jay. And, I just wanted to end, since I am in Pittsburgh, I felt it was fitting to really start with Mr. Rogers. And, to really take a moment to say, people have been taught to look for the helpers, and that, we are here and we are helping. And there will always be us who are doing that. And to really say, I took this photo the other morning when I was running, to really look at saying thank you to first responders. And, sometimes there's been a lax in identifying us in social work as first responders, but we truly are the ones who, as Mr. Rogers just said, little people, our children will look to when they see something scary in the news, or they see something scary at home. Who are the ones that are going to help them? So this too shall pass, as is written on my workstation, when I look at every morning. And, how will you respond next? Thank you, Jay.
Thank you, Jackie. That was, wow. The more I hear about how Allegheny County is working with its partners during this, it just seems, with everything that's going on, they're really maintaining what you said, meaningful connections as opposed to just connecting. Just the idea of giving your partners a pre-media alert, I think, talks about a meaningful connection. I also think what you said, the analogy really hit home. We went from a sprint to a marathon. We didn't know we had to train for a marathon. So I think that analogy is really good, and how the county's had to work with its partner to go from sprint to marathon. So thank you, Jackie, so much. And our next speaker actually falls right in line with what Jackie was speaking about. We're going to be looking at data a little bit more for the next 10 minutes. So everybody knows we've been starting to hear about data and more on media now, instead of just inside our agencies, a lot of people are starting to talk about data, not just about flattening the curve, but also some data in regards to health and disparities, and looking at that a little bit deeper. So I'm going to introduce you to Dr. James Freeman. He is an MSW, also University of Pittsburgh School of Social Work. He also has an MBA, an executive leader from the Katz Business School, and he has his PhD from Morgan State University in Baltimore, Maryland. Also, he has a great lens because he's also a licensed clinical social worker. He has licenses in both PA and North Carolina, and he's going to give us some great insight on data. So, hi, Dr. Freeman, how are you? And so looking what you're going to talk about, we know that data has always informed best practice, and Jackie alluded to that, this role of data in child welfare. But what should we be looking at now to measure the impact? How is data changing, or how is it staying the same? From your perspective, we're going to hear a little bit about data. So handing it over to you, Dr. Freeman.
Great, thanks, Jay. Basically, what we're going to be looking at in this time is more from the macro lens of how do we tell the story, and then how are we making sure that we're gathering the right data points, and that we're definitely telling the story that best describes how we are impacting families and children. Jay, you can go to the next slide. So from this presentation, we hope that the 3 takeaway points is, really about this whole concept of data collection, and then moving from data collection to family assessment, and then performance monitoring. And when you're thinking about data collection, you got to think about what are the relevant points in the service delivery process, and then how is that information collected, gathered, and then how does that information get examined, and then how is it being utilized in the organization. And when you're looking at data, every organization now has to define for itself, what is our change theory? And then that lends itself to how do you address your family assessment, and how does that impact your program model? And so when you're looking at your program model and your intervention, you have to be able to think, where are the touch points in that intervention model that make sense, that should be being collected, and that really demonstrate the worthwhileness or the impact of your program model. And then how are you monitoring that? What is that performance monitoring opportunity, and when is the agency looking at those numbers, and then how does those numbers then get translated into a larger scale of how do we share how we're performing as an organization? So you can go to the next slide. So now, once we've used, the data to tell a story about how the children are doing, or how families are being impacted, here's some data impacts. In managing data relationships, it is always critical that the management relationship remains solid. Even more so now in the period of COVID, where the direct supervision and direct day-to-day management has been altered. A lot of the partners earlier began to speak about how they adjusted to daily reports and different types of mobile to mobile calls and FaceTime calls and Zoom meetings. But that managed relationship takes on a whole nother level of how we're ensuring that that work is being done and that data is being captured. And so the next point is, you're making sure that those daily entries are occurring. We used to be able to have some leverage because we would see each other and you would be able to know what work is being done. But now, during these periods, we have to make sure that those adaptations are being made, because we don't want to miss information, and we don't want people to be going on during this time being vulnerable, where we have gaps in services and things that are being missed. The earlier presenters talked about emergency reporting procedures during this time, making sure that the warm lines are being monitored, and who's collecting that data, and how does that data inform the decision makings, and ensuring that the data is being shared. It's not good just to be collected, but we have to ensure that data has a larger scope and that it is being shared broadly. Making sure the right information is being collected. So that means that information has to be shared across systems. A lot of the earlier partners talked about before some of these changes were made, there was communication that was had with the partners, with the employees, the staff, the families. How do we capture the voice to make sure that when we are now making the changes that is representative for the population, but now that we have the changes, how are we ensuring that the information that's being gathered and collected represents the service? And then that data then drives new decision making and future impact, so that we're not only ensuring that information is being collected, but the information that is collected is able to be utilized and it impacts the service. And then once those conversations are being had, it's an opportunity for us to identify the gaps. What are the missing pieces? Have we considered all of the opportunities, and then all voices been heard? And so in making those adjustments and really beginning to see how this data portion of the work that we do contributes to the larger functionality and the success of programs is a major portion of what we have the opportunity to do as we move forward. Jay, you can go to the next slide. So they called me in as an academician. So one of the things that we looked at is in preparing for ensuring the right data is being collected and that the model is being represented by the data points that are reported, and that we can actually talk about the success of the intervention while we monitor the performance. I wanted to talk about how those challenges and threats can be averted. And so one of the things that in the academic portions in child welfare, when you look at data, they talk about the outcome monitoring. Now, this includes where the define and validated, implement, and model outcomes measure are in this phase. Outcomes are defined, validated, and are reliable. Measures are constructed, and the data is collected to evaluate and corroborate performance. So we have to define the outcome. And so once the outcome is defined, we can then validate that outcome and then monitor it, and then make sure that we can move goals in future monitoring on the same. And then you can move from the outcome monitoring to the data analysis. And this is a phase where you're looking at the data and you're beginning to see, what does the data tell us? We state that this is the success, this is the outcome that we're wanting. But now, once we're looking at the data as a whole, how do we ensure that we're doing the right thing, and how can we best utilize this analysis? Then there's the opportunity to look at the research. What are other programs doing? What activities out there that has evidence to support what we're doing, or what programs should be doing as it relates to the data that we're collecting as it proposed to our models and our intervention services? And then the evaluation portion. This is, an opportunity to tell the story. It includes activities and procedures required to consider promising interventions for children and families to determine if the implemented services on a wider basis is warranted. See, now we're looking at how do we systematically evaluate program services so that we can say that what we're doing is actually what we should be doing, or should we be doing something else? And how then now do we make those necessary adjustments and needed improvements as we move forward from those analysis, from that opportunity to look at the larger marketplace and research, and then evaluating what we've done, and then now making sure that we're always continually making improvements to our services. Jay, you can go to the final slide. So in this time, I just wanted to be able to leave the conversation with how does best practice inform our work? So one of the things that COVID-19 has left us with is that we may never be the same after this opportunity. Services has rapidly shifted, and delivery models have drastically changed. You have a lot more video. My mom had surgery, and her post-surgery was done, her post-surgery visit was done through a video with the doctor on a screen. And you just see a lot of the changes that have begun. They're probably going to become a norm post the service. So how will agencies and organizations practice models change post-COVID? And we need to be in front of that, looking at the data that we're now collecting and the modifications and adaptations we've made. How will this be impacted in service delivery once this is over? You know, monitoring how families' needs change during this interruption of services. You know, what are the unique things, and who's capturing the quality of that data? You know, more than just the quantitative nature of the analysis, but also, you know, what has the needs of the families given us information to as we shift through this COVID opportunity? And then, you know, and I know that we have a diversity and inclusion expert that's going to speak next, but just making sure that racial and ethnic considerations have been made in the assessment. And then making sure that once we move forward, that we're collecting the feedback from all of the partners, family, staff, and the community. And so just hopefully what we've gained is looking at how do we use data to inform decisions that creates knowledge, so that hopefully we get to the lessons learned and have practice wisdom that we can take these services into the future. Thanks, Jay.
Thank you, Dr. Friedman. That was great. I always enjoy listening to you talk about data, because I think you make it real, and I think you go back to the fundamental that the data has to be telling a story. You said so many important things, but one of the things I thought was really impactful, because Jackie talked about it as well, it's not just collecting the data, it's sharing the data. Because if you're collecting and not doing anything with it, then what's the point? And the other thing I think you made really relevant, which seems obvious, but people just don't listen to it sometimes. It's not just collecting data points, it's really looking at what you just said about the relevant data points to speak to what we're doing. So thank you for that information. And just as a side note, everyone, we will be sharing the slides with you on the Second Chance website after the presentation. So we're going to shift, but as Dr. Freeman said, we do have a diversity, inclusion, and equity expert coming up. This is pretty relevant what's going on right now, because people in the beginning were saying things like, you know, COVID-19 does not discriminate, and and indeed, we're not any death, whether any race, any ethnicity, race, gender identification, sexual orientation, every death is devastating. But last week, when I was reading the news, you know, there was something from Charles Blow of the New York Times, and he said the racial time bomb in the COVID-19 crisis. And that really spurred a lot of thought. At Second Chance, we are a culturally competent model, but we are also a racially competent model. And I think that distinction is important. So I'm pleased to introduce Arandi Miller. We're very lucky to have him. He is a program officer from the W.K. Kellogg Foundation, which is in Battle Creek, Michigan. He leads a team that's focused on applying a racial equity and community engagement lens in both the organization's internal operations as well as the program investments made by the foundation, which I think is so important, the investments that they're making. He is also on the board of directors for the BACW, which is the Black Administrators in Child Welfare. And he led a national institute that was aimed at helping professionals of color make sense of race and racism and culture and how it operates in public systems like child welfare. So I am pleased to introduce him. And Arandi, you have an in-depth subject to cover in 10 minutes, but we're really, really interested in hearing what you have to say and speaking about, you know, how is COVID-19 really impacting diversity, inclusion, equity when we're responding to communities of color, communities at different socioeconomic levels. So take it away, Mr. Miller.
All right, thank you, Jay. And I also want to say thank you to Dr. Sharon McDaniel and Bracelo and A Second Chance, just for the invitation to join you all today, and more generally for your leadership at this moment in the field. It really is a privilege to be able to join you all and be a part of this conversation. I want to take a few minutes and talk about the racial equity, or what I would describe as the racial equity and racial justice implications of this moment, which certainly does tie in under that umbrella, these considerations of race and racism and culture and ethnicity, and so what we think about as diversity, equity, and inclusion. You know, I work at the W.K. Kellogg Foundation. I've been there for about 4 years. And while we don't consider ourselves to be a child welfare foundation per se, we're all really clear that the priorities that really drive our investments, they really do make a really significant, hopefully in most cases, contribution, but really influence the kinds of system strategies, access to resources, access to services, and sort of responsiveness to the challenges that families and children are working through within communities. And so very much we think that the work is directly related. I'll also say that core to all of our work, and I'll ask if you could go to the next slide, core to all of our work is really a focus on racial equity, community engagement, and leadership. And within that context, we're pretty clear that those same principles, those dynamics, those practices are core to any of the work that our nation's public systems do that directly touch the lives of children and families, and that certainly includes child welfare. And so for us, that really means a focus on thriving children from the earliest ages, birth through age 8, working families so that families have access to resources to take care of their children and provide them with the opportunities that they need to grow into productive and successful sort of contributors to their community, and then equitable communities. And so central to all of our work being a focus on understanding and trying to undo the effects of racism on all of our systems, our policies, our practices, the resources that are available to children and families and communities. Can you go to the next slide? So for starters, I think it's important, you know, as Jay began to indicate, and my hope is that during some of this conversation, it will really affirm sort of the significance of much of what you've heard in the presentations that have led up to now. The work that folks are doing there in Pennsylvania and certainly some other parts of the country is really innovative in some ways. It's ahead of the field in some ways, or I'll say in front of the field in some ways. And I think that's the kind of leadership and practice and sort of policy shifts that we want to see more generally. And so, you know, this moment, as Jay began to indicate, we know that the COVID-19 pandemic has really exposed something that's been present for a long, long time, really throughout the history of this country. And it's also deepening some of those same health and well-being disparities that we've seen over time. And the important thing to note here is that these are structural disparities. These are racial disparities that have been created by systems and policies and practices that have been developing over time. And so you can see sort of the range of things there that really make Black and Brown communities much more likely to sort of experience the worst end of this COVID-19 pandemic. So chronic disease, I'll add to that the dynamic of stress and weathering. So, you know, continually having to deal with this feeling of getting beat up by racism and the effects of discrimination and oppression within U.S. society and the effect that that has on the immune system over time. So that dynamic of stress and weathering predisposing people to sort of the harsher effects of harmful health conditions. Healthcare insurance, access and quality tending to be less for Black and Brown communities, poverty and loss of income, and the implications of loss of income and loss of jobs sometimes in terms of losing health insurance, low wage, and you know what people describe as forward-facing service jobs. And so it really is these jobs that take people outside of their homes, which increases the likelihood that they'll be exposed to this virus. And so those are most oftentimes service workers, lower wage sort of jobs and roles, as we see now, service jobs, delivery jobs, and customer service jobs and the like. And so that increases the likelihood that people are exposed. Housing, density of living conditions, transportation access. You know, I'll tie it to this dynamic of transportation, both the professionals who are doing, who are sort of serving in these roles, but then also residents relying on transportation to get to and from, which predisposes them. Environmental racism and pollution, access to healthy food, or maybe we should say the lack of access to healthy food options and sort of institutions. And even some of the basic things that many of us take for granted is, access to plumbing and running water and electricity. And so all those things sort of create the structural dynamic that has sort of found us where we are. The other thing that you heard, race data matters. We've seen in a number of places that Black, Latino, Native people, Native and Indigenous people, in some communities, even some segments of the Asian and Pacific Islander community are predisposed to either the virus, the harsher effects of the virus, and even death. You also have the impact of centralized testing and treatment, so that people have less access, have to travel further, and the like. And we're also seeing this dynamic of denying or rationing medical care and the bias that's included within that. If we can go to the next slide, we also know that racial disparities persist in the experiences and outcomes for families who are involved with this nation's different child welfare systems. And the dynamics that you see sort of spelled out on the page are really some of the dynamics that we've seen as major factors that either drive racial disparities in child welfare, and in some cases even help to reduce some of the racial disparities that we've seen in some of those systems that have really taken a lead role in that work. And so the use of flexible funding options to meet the material support and resource needs of families, access to high quality and culturally responsive supports and resources, the timeliness and frequency, the quality of visits between children and their parents, also their siblings. You heard some of what we talked about, what some of the panelists talked about in terms of coordinated responses to families by multiple professionals in different family serving systems. And then, of course, the dynamics related to technology, access to either the technology, the broadband internet service, and the like. And then also some of the same things that we've seen, the importance of creative strategies for engaging fathers and members of the extended family network, even in this moment that we find ourselves in. And then the collaborative planning and decision-making processes with families. And we heard a little bit about that as well, and that's just critically, critically important. If you go to the next slide, there was a piece that came out in the Chronicle of Social Change, and the reason it's significant is it was written by Jerry Milner and David Kelly, so the Associate Commissioner of the U.S. Children's Bureau at this moment and the Special Assistant. And so it's called Family as a Compelling Reason, and to have these sorts of statements that have been provided to the field from the sort of federal leadership is really important, because it really talks about this moment as a real critical moment for us to figure out where our values are as a field, as a child welfare profession, but then also this notion of justice and injustice for families. And so these are some of the considerations that they laid out in the piece. And so it's the importance of safeguarding against racial and cultural bias. They named it. It is an expression of racism as we see it, certainly in our work. The importance of protecting family integrity at this moment is critically, critically important. The clarity that prolonged family separation is itself a source of harm and trauma for children and for their parents. And then strengthening child-family sibling relationships is absolutely critical. And this is not just important work, it's absolutely important work. But we know that this work, it also impacts brain development, it impacts, and potentially, if done well, it helps to reduce trauma. And then trauma has a way of sort of manifesting itself in the responses of both families and parents and children in their interactions with professionals who are involved in, sort of their experience with the system. And so this is just absolutely, absolutely critical. Reunification as soon as healthy, as soon as health or the safety threat is no longer present, has to be a priority. And in this moment, COVID-19 in and of itself, the presence of COVID-19 in a family in and of itself cannot be considered the primary safety threat to keep children from returning home. The other thing that's important is that the conditions, especially the economic conditions that this crisis has developed for families, also can't be the reason for keeping children from going home with their families, with their parents. We've seen, and this is not unusual, but it's still happening today, where parents are close to reunification with their children, but because they lost a job or because the job hasn't come through because of this crisis that we find ourselves in, agencies feel like they can't return the children home. Well, we have to show leadership. We have to do our advocacy so that we can get the material supports and resources that parents need, because their desire is there, their commitment to their children is there. Anything that they've done, that sort of jeopardizes the safety of their children, they've worked on those things. So we've got to find every way possible to make sure those children get back home and minimize potential future harm to both the children and their families of origin. Child welfare systems, within the Adoption and Safe Families Act, there are timelines that really speak to moving children towards, permanency. And so the dynamic of filing for termination of parental rights, agencies have some discretion. And so these are the kind of moments where agencies, especially agencies that are centered in the values that you've heard described on this call, are really going to try to do that work to make sure that children have every opportunity possible to go back home and not make rush judgments because it's harder work, and especially harder work at this moment. There's also the importance of courts and attorneys, especially at a moment like this, to help make sure that families and parents and children are getting access to the kind of supports that they need, and understanding that it's really difficult, and so that might have implications for timelines. One of the things that they mentioned in the article is this notion of good intentions and misguided efforts. And what we've seen in the field in the past is that, a lot of the practices and policies, people would argue, are really coming out of good intentions, but they still have horrible and racially disparate outcomes in terms of the impact on families and children. And so good intentions are absolutely important. And sometimes our efforts can be misguided. And so we have to be really careful. That's the importance of data, to find out whether or not, you've heard this from some of our previous panelists, to find out whether or not what we're doing is having the impact that we intend for it to have. And if we're noticing patterns and those patterns aren't creating the outcomes that we want, then we have to find innovative ways to sort of get to a different outcome, so that children can be back with their parents and their families. If we can go to the next slide. And these will be some of my concluding remarks. The field has accepted racial disparities for a long time as normal. And I'm saying the field at large, certainly not true for everyone in the field. But the field knows how to support families. We have innovative strategies. We've done the work. We understand child development. We understand family development and socialization. And so we have to extend the best of our knowledge and resources to families who have been most marginalized. And so that's the work that we have to continue to do. It's also clear that our social safety net systems consistently become more punitive and restrictive as the recipients become, as we would describe, blacker and browner. And so there is this empathy gap in our society, and it certainly is true in our helping professions as well, where we make judgments about who deserves support and who deserves to get their children, which parents or families deserve to get their children back. And we know that that dynamic is still present, not shared by everyone, but it absolutely drives a great deal of practice in this country. Targeted universalism, we would argue, is a better strategy, where we target the resources to the places and the families that we know have been most either marginalized, who have least access, and who need that support the most. And so that's very different than sort of equality, where everybody gets the same of everything. We need to target our resources where they're most needed. And then our policies have to evolve to reflect our knowledge of child and family development. We have to continue to push our policies so that families get the kind of support they need, they get the time that they need to do the healing work that's necessary and important, and so that children can stay connected to them even as the families are doing that work. And this absolutely is the time for family-focused flexibility. Managing with the resources that we have and the policies that we have is not always enough. We've got to advocate. We've got to advocate for those additional resources. We've got to advocate for the flexibility that's needed so that we can actually make the sort of knowledge that we have about children and families come to life. And I would say now more than ever is when we have to lean into that work, given this crisis that's before us. And we have to do it for all children and families. The last thing that I'll say, last statement, is that our social workers, our child welfare professionals, are on the front lines out there working with children and families, sometimes with the equipment and resources that they need, and oftentimes without. And so you all are real superheroes. And so we recognize that you all really are working and standing on a tradition of innovation and practices that predate you, but that you're also contributing to. And so just want to say thank you to all of you all, and continue to do the good work, and let's push for better outcomes that we know are good for our children and families. Thank you.
Thank you, Aranda. That was great. You said something interesting at the end. You said, we have to lean into these conversations. And when we were planning with the webinar, Dr. McDaniel and Brace said, we want to make sure we have conversations that we're not just addressing, but that we're actually leaning into a conversation. So thank you for saying that. The other thing is, when we wanted to see where we were going to end, and we decided to have you as the last speaker, that was important, because one of the bottom lines of this whole crisis is this is not just a health crisis, it's a social justice crisis as well. And I hope the information you got from Aranda helped you thinking of that, because there are many sectors that are addressing COVID-19 who are not really looking at the social justice and the racial implications of what's going on. So we wanted to end with a quote, but I wanted to thank everybody first. I wanted to thank each of our speakers who took time out of their day, not just today, but also in preparing to present to you as a panelist today. I want to thank Dr. McDaniel, our CEO, and Brace, our COO, who helped us really move this forward in real time. They wanted us to respond with a sense of urgency to get this posted right away, and we were able to do that. So thank you to both of them. And finally, I want to thank everyone who attended today. We're really humbled by the response we got. And we wanted to end with, but before actually, Leanne, I want to tell you, we will have a recording of the webinar on our website, and we will also be sharing the PowerPoint slides. We have over 200 questions, and we do not have time to answer them, but your questions are very important to us, and we are looking at setting up a community board that you will be able to ask your questions, and then our panelists can answer those questions, on a community board so everybody can see your answer. So we wanted to end on a positive note saying that failure will never overtake me if my determination to succeed is strong enough. And one of the things that we always talk about at Second Chance is that our determination is when we stand stronger together with our partners. So we hope we showed you that at today's webinars, the idea of partnerships, the ideas of working together is really what's going to get us through this virus. So thank you once again. Have a good and safe day.